Thank you very much again for speaking at this panel on skills and strategies for policy impact. And today I would like to share how I expanded my academic role to include also political advocacy and the strategies and activities to influence real policy change. So what led me to this new path, I have to confess, was a deep frustration, of seeing that the intervention I worked in for the last 10 years called Mamás del Río or Mothers of the River was never going to influence policy. So, and I just couldn't accept that after years of work with the communities, my intervention was going to be one of the thousands of interventions that we as researchers design, evaluate, prove that are effective, and they never get to see the real light and impact the people they were really meant to help. So also I have to confess that Mamás del Río started as part of my personal story. I was doing research as part of my Fogarty Fellowship in the association between two virus in indigenous communities in Ucayali. And at that time I became pregnant, and that pregnancy changed my life in the sense that I was able to witness more clearly the enormous gap in access to healthcare that women and their families face in these indigenous areas. And I think this connection between Mamás del Río and my personal life, my pregnancies, my daughters, is what keeps me advocating for the communities in the Amazonian areas. And actually, this is a picture of me and my daughter. She was 3 months old, now she's 14, driving and in the river in the Amazon. So what do we do in Mamás del Río? In Mamás del Río, or Mothers of the River, we train community health workers to conduct home visits to pregnant women and newborns. And the innovative aspect of our program is that the community health workers use a tablet that has an application where they show informational content, and I want to emphasize this. Several of the content was created by the communities, actually thanks to a Fogarty Fellow through a process of photo voice and storytelling. So the application has digital stories, and also through the application, the community health workers can gather health data. We also train traditional birth attendants, healthcare personnel, we conduct community sensitization, and we provide continued supervision. And actually, from the beginning in Mamás del Río, we wanted to invest in the communities, not necessarily in the post or in healthcare establishment, because they don't have access to those. So from the beginning, our work was clearly focused on the communities and on the community health workers. So this is the area of implementation. We started our work thanks to funding from Grand Challenges Canada and the Peruvian Council of Science and Technology in 84 communities along 350 kilometers of river extension in 3 major rivers, Marañón, Ucayali, and Amazonas. And also, at that time, the Ministry of External Affairs, who has been the minister who has supported us the most, saw potential in our intervention because they wanted to implement a program in the border with Colombia. And they were unsure of what to implement. So they told me, Magaly, can you do a presentation of what you're doing in Mamás del Río for us? So I went to the Ministry of External Affairs in Peru, and they liked the program. And after a 3-year negotiation period with Colombia, because since this is a binational program, both countries have to agree exactly on the same activity that they are going to implement, the program was approved at the 3rd binational cabinet, which was an important meeting because it was the president of Colombia, at that time was Santos, and the president of Peru, at that time, Pedro Pablo Kuczynski. And I actually was in that room on the back when the program was approved, and it was named as one of the initiatives that was going to be implemented in the border with Colombia. And for me, as a researcher, was a super important moment because you write a grant in a piece of paper, you submit your application, and then you see it actually being implemented, and you run the implementation in your country, but then it goes to another country to help more people. So it was a very happy and a very proud moment for me. So in Mamás de la Frontera, which is Mothers of the Border, we're operating in that area in the border with Colombia in 4 districts along the Putumayo River. It's a more complicated area because it's more remote, and also we have the presence of 3 armed groups, which makes the implementation even more difficult. and we also have cartels. So it makes it more difficult, but it also is more relevant for the population to have a program like this. And here, the activities of community health workers have expanded. They not only work on health, but they also work in something very important, social protection. Why? Because they, for example, identify children who don't have an ID card, something that is super basic, an identification card that children in the border don't have. Actually, in our baseline, 30% of children don't have an ID. And also, community health workers work on that, and also they refer people to this huge medical ship from the Ministry of Development and Social Inclusion that carries several governmental programs like cash transfer program, for example, Juntos, and this ship even has a bank for you to get your money for your cash transfer program. So we have done extensive research and we have proved that our intervention works. We published this on the Lancet Regional Health Americas, and we proved that Mamás del Río was able to improve almost all essential newborn care outcomes related to thermal care, breastfeeding practices, and core care, and we were also able to increase institutional delivery and early newborn checkups. We have generated evidence from the formative phase to the implementation, to the evaluation, to the adaptation to the COVID pandemic, and we can tell the story, and we are proud of that, of Mamás del Río with scientific publications. We got 4 awards, 2 from the Pan American Health Organization, 1 here in Washington, D.C. as a social innovation in health program, and 1 in Peru for the implementation of Mamás del Río in the border with Colombia. On top of that, we created ICARA, an NGO that aims to increase understanding of Amazonian and indigenous and rural health in several areas. We're working on the prevention of adolescent pregnancy, mental health, community empowerment, and we also will be working on environmental pollution soon. However, even though you test your intervention, you work with the community, you publish in good journals, that doesn't mean that you are going to influence policy. And actually, that's a lesson I learned in the hard way. So 3 years before finishing Mamás del Río, I started conversations with local, regional, and private institutions. We held like more than 60 meetings. But I realized that that was not the way. We were never going to influence policy from the academia, because the academia have a voice that is not so strong, at least in my university. So nobody cares what my university says to influence policy. So that's when I decided to move to a different space, which is the Peruvian Medical College. So if you check the institutions in Peru, the institutions from the civil society that can influence policy, the Peruvian Medical College is one of them. However, you have to go to elections. Basically, the Peruvian Medical College represents all physicians in Peru. And it's powerful because if you are a physician, you cannot practice if you are not enrolled in the Peruvian Medical College. So we have a strong power, and we are in every region of the country. So we went to elections. It was difficult. I wasn't, as a researcher, felt comfortable with my face on a poster, but I think I have to get used to that. And we won, actually was under the direction of Dr. Pedro Riega, who is on the picture. So I became the head of the division of political advocacy in medicine and public health. And through that division, we actually influence public policy and legislation at several levels. We work with the Congress, we work with the executive branch, and also, and I love this, we work with the civil society. So for example, in 1 year of our work as a head of the division, we have already reviewed 227 health-related bills during this time. And we actually give our opinion if we want the bill to be approved or not. No? And of course, depends on the Congress if they do it or not. We also attend Congressional Health Commission sessions, which is important because we are at the moment when the decisions are being taken. And we also can advocate for causes. Like, for example, this is when I advocate for the elimination of cervical cancer in one of the sessions for the day of the elimination of cervical cancer. And this is very important. We have the right to introduce legislation, so new bills for the Congress. One of the things that I like a lot is defending human rights. So for example, we have denounced the Ministry of Education when he called raping indigenous communities a cultural practice, and this is our statement at the Peruvian Medical College. Or for example, when the Ministry of Health assigned the trans identities under the umbrella of people with mental health problems. For example, for this, we had meetings. Of course, the LGBT community was super furious, and we went with them to the Ministry of Health, and they actually changed this classification. We also advocate for patients. So for example, on special days, like the day of the rare disease, we illuminated the medical college, and we also demand implementation for patients. So for example, this is a picture when we were protesting, and this is something new also for me. I don't used to protest, now I am used to that. So this is a very important skill, actually. So here we are in front of the presidency of the Council Ministers demanding the implementation of regulations for loan-approved but unimplemented laws for people with rare diseases. And after this protest, one day after this, they approved the regulation. So it works sometimes. So also, we march alongside communities. For example, this is when we march for the Day Against Child Abuse, for the International Day for the Elimination of Violence Against Women, but very importantly, and this is also great, the communities march alongside us. And this is a huge march we did when the rights of doctors were violated by a law. I will not go into deep today, but I marched with the community health workers in Lima. This is a huge march. This is only my part, but there were 1,000 people who marched from the Plaza 2 de Mayo to the Congress. And this was a very, very important day. Now, based on our intervention in Mamás del Río, what have we done to influence policy? Actually, this is our slogan: los agentes comunitarios de salud salvan vidas, apoyemos la ley que los protege. So basically, community health workers save lives, let's support the law that protects them. That's our slogan for our continuous campaign. And what we have done is first advocating at the Congress. You know, what surprised me when I was implementing Mamás del Río is that by law, community health workers are volunteers in Peru. So they cannot earn anything. They cannot earn any incentive. They are people who live in poverty and extreme poverty and have to work for free for the government. And for me, that was just unfair. So what I say is, okay, let's change the law. And that's what we started 1 year ago when I assumed my position at the Peruvian College of Physicians, and we have advocated for 3 laws. I have co-authored 2 of the laws, and I was formally recognized in one of the laws. So that is something that also I learned to do, and it's a new skill I acquired in this position, which is very, very important. Learn how to write a bill. And so these are some of the Congress men and women who have pushed for the legislation. And what we ask in this legislation, in this bill, we ask for 3 things: a better training for community health workers, better supplies and materials, and also, and this is very important, social protection. So basically, health insurance, death coverage, and an economic incentive for them to work, because it's unfair that community health workers don't receive anything, any support from the state. I have seen community health workers die when I was doing the implementation, and nobody took care of them. So for this, of course, we have done a lot of advocacy with my partners, with my compañeras, as I said, in Lima, in the Congress. And we have also written policy briefs for this. And one of the most important things that I have done here is to advocate in the Health Commission so that they can approve, the Health Commission can approve the bills that were presented. And for me as a researcher, I have to summarize in 10 minutes how community health workers impact the lives of people, the research that we have done that prove that they are effective, and then a final advocacy for them to be part of the health system in Peru. And I did this advocacy with my compañera, Carmen Vilela, who is there, and she also advocated as a community health worker. And I think, for me, This was one of the most important presentations I have done so far. So we not only work at the Congress, but we also pushing changes at the executive branch, and this is our meeting 2 weeks ago with the Minister of Health of Peru, where we told them how important it is for community health workers to be part of the health system, and he agreed to establish a second of sessions, basically sessions with different stakeholders. They have done 2 so far. I have participated in one of them. And the idea is that when the law comes to the executive branch, they will accept it, or they can have maybe, they can push it from the executive branch. So, but we know that the 2 things that I told you, which is doing influence at the Congress and doing influencing the executive branch, may not work, and we know that, no? So we have also, this is how important it is to work not only from the top down, but the bottom-up approach. So remember I told you in my presentation on Monday that community health workers in the area of Mamás del Río created their own association of community health workers called ACOSIL, Asociación de Agentes Comunitarios de Salud Intercultural de Loreto. And the objective of their association was to fight for their rights and the rights of the communities. However, fighting for the rights is difficult to do it from the Amazon because they don't have a stronger voice from up there. So we had, with partnership with the Red de Promotoras de Salud de Lima y Callao, so the network of health promoters in Lima and Callao, and this has been a very important partnership, because with them, we are organizing the national network of community health workers that don't exist so far. So basically in Peru, we have networks of community health workers, for example, in Lima or in Iquitos, but they are not organized. And I think with that, we will have a stronger and unstoppable voice to change the law for community health workers. And this is what we have been doing. Still, it's not legally this new network, but we have had meetings in person, also by Zoom. And every time I do all of what I do, I always have in my mind the communities with whom I work. And this is very important for me, and this is what keeps me going on and what keeps me advocating for the communities. And finally, I want to end with a slide that I borrowed from my mentor, Dr. Luis Gabriel Cuervo, that says, academics see the light and policymakers feel the heat. Academics and policymakers have different objectives. We have different demands. We have different time frames. As academics, we can spend 10 years, like me doing Mamás del Río. For a policymaker, they have months to achieve something. But we need to speak with each other, and that is very, very important. As academics, we need policymakers to influence policy, and as policymakers, they need academics to make decisions that matter. So I want to end by saying that in the next year, in your coming year in your fellowship, I want you to also become an advocate for the populations that you are working with. Thank you very much.